Well, hello, everybody. I'm Nelson Weston, and y'all know what time it is. It's time for an all-new segment of Spotlight Carolina. Joining us today is Dr. Meredith Kapler with South Asheville Veterinary Emergency and Specialty. Doc, good to have you on the show.
Thanks for having me.
It's a pleasure. So, Doc, tell me all about the role of a veterinary surgeon. What does that entail?
So a veterinary surgeon is a specialist that's done extra training after veterinary school to specialize in both soft tissue and orthopedic surgery in pets.
Ah, very insightful. Now, let's expand upon that term of pets. You know, what are some of the most common orthopedic problems that you find in pets, in this case specifically in dogs?
So we commonly see CCL tear in dogs, which is an injury to the knee. That's what we tend to see most commonly as an orthopedic injury.
Okay. Now, for the sake of clarity, Doc, what is the main difference between an ACL tear in, say, a person like you or me and a CCL tear in a dog?
So in a person, we have an anterior cruciate ligament. That's the technical term.
Okay.
In a dog, we have the cranial cruciate ligament. So it's a name change, but it is also, in a person, an ACL tear is more traumatic in nature. So, you know, downhill skiing, playing football.
Right.
But in dogs, we tend to see CCL tears happen spontaneously due to degeneration of the ligament.
I learned something new today then. Now, let's just play devil's advocate, though, and let's say there is a dog out there that has, in fact, experienced a CCL tear. What treatment options are available today?
So we can try a couple of different things. The conservative approach is to put the pet on some anti-inflammatories and some rest to see if some of the inflammation and pain resolves. But unfortunately, a lot of pets have too much instability in the knee after the injury, and they end up requiring surgery to help stabilize the knee.
Now, Doc, given your experience in this field, what are some tips and advice you can share with all pet owners, in this case, dog owners today, that will ensure that their dogs have strong and healthy joints as they move forward?
So ultimately, I think making sure that the dogs are a good weight. A lot of pets are overweight, and that can put extra strain on the joints and put them at risk for arthritis and injury. And then also making sure that they have an active lifestyle. So they're getting out and they're going on walks and hikes and swimming and making sure that their joints are kind of moving and well supported by muscle. That's always a good thing to do.
That does sound fantastic. And Doc, you sound very passionate about this line of work. You know, I have to ask you, shed some light on your background. You know, what got you into this field in the first place?
Well, I've always loved animals. I've always loved medicine, and it just was a natural fit for me. I like to do things with my hands, so surgery was something that I was drawn to from the beginning.
And I'm confident you have some dogs, is that correct?
I do. I have 2 dogs.
That's outstanding. And Doc, before I let you go, for the sake of clarity, are you guys accepting new patients, or in this case, new canine friend patients at this time?
Oh, absolutely. Come on in.
All righty. And where can we find you, by the way?
We're at Saves, which is over in Gerber Village.
Okay. Well, Doc, as always, I want to thank you for taking the time to speak with us here today.
Thanks for having me.
Of course. And for more information, folks, and of course, to book an appointment today, you can always visit southashevillevets.com. You can also call 828-210-8285. I'm Nelson Weston, and we'll see you next time on Spotlight Carolina. Today's Spotlight Carolina was sponsored by South Asheville Veterinary Emergency and Specialty.